went in on a Monday morning and she examined it. She said, we got to send a biopsy off. And they did. And so that evening, Wednesday evening, before we went to church, she called me on my cell phone. She said, I hate to call you. She said, Mr. Gibson, I hate to tell you it's cancer. And I said, well, that's okay. That's no big deal.
Bobbi, I know that you were the main reason that Chelcie went to go get checked out. What did you notice? Was it a mole to begin with?
It was not that big, but just a kind of a dark mole. And I said, you should maybe go have that checked. But we waited, and then a little later it started getting a little bigger and was crusty like over it. So I said, Chelcie, why don't you go get that checked? Oh, I will sometime, you know. So it was probably close to a year.
Probably was.
And then this one day I looked and it had a blister up on it and it had been bleeding.
Oh, wow.
And so by then, he kind of thought it was serious. So he thought, well, maybe you're right. I should have it checked.
I think it kind of turned, I'd say that the bad part was there, maybe less than 6 months, maybe, wasn't it? Probably like that. And then I just thought, well, I better have it checked.
And you'd been a long-time patient at Dr. Amy Vaughan's
We have
office.
been at Dr. Amy's. I'm not sure how long. I hadn't been over for a few years, but yes, we've gone to see her. We like her real well.
And so tell me the story that when you decided to get it checked, you called immediately?
Well, it was on the Monday morning. I actually had a doctor's appointment at the VA. I thought was 3:30 that evening on a Monday, but it was actually 8:30. I didn't go to it, and I called and I said I'd go if I could get in. I called and they had a cancellation. So I go over there.
Like 15 minutes later?
30, I think 30, something like that. 8:15 I called. She said if you'd be here by 8:45. So I did.
Oh,
and
amazing.
that's how they checked it out. And I really never thought anything about it.
Yeah, you never thought that you had melanoma?
No, I really never thought that. And I told him, I said, because I'm a minister, and I said, access being that, praying for other people, I didn't worry about it.
Right.
Well, it's in the middle of the road. If it's bad, let's take it out. If it's good, praise the Lord either way. And it really went that way. It really went so good. With Amy Vaughan's office, so good. Hey, how are you all?
Hey, welcome.
Hello. Our little mountaineer girl.
That's right. Hey, how are you? It's so good to see you guys.
That's you too. It is good to see you.
Go her.
It is good to see
How are
you all.
you?
I'll take a hug too.
And he was just so grateful. I'm so happy that we had just taken the time and just looked at it. He just thought it was nothing. He thought his wife was just pushing him in here to get it looked at. So we took one look at it and I was like, well, this does not look good. So we went ahead and did a biopsy that day. We got the biopsy back and I did call him and then had him come into the office and we went over kind of the results and all the options that he had.
So do you wish that you would have gotten checked earlier?
Oh, much earlier. And you know, because when I did, Amy's checked me before, but it's been a couple of years before that. But it just, and if it hadn't been for precious wife, I wouldn't have done it.
What would men do without their wives?
I couldn't make it.
It's something that you have to act quickly.
Sure.
I think once you do get the diagnosis, for peace of mind and just to get it taken care of as quick as possible.
Yes.
As you guys know, it's May is Melanoma Awareness Month, so we really appreciate you all coming in and talking about this. There's so many times that people I think are afraid.
Yes.
Because they're afraid of what we're gonna say or what the results will be. And I think that's the biggest thing is get people over that fear. And it may not be having a dermatologist look at it, having your family doctor look at it, have your pediatrician, have a nurse practitioner at the office look at a plastic surgeon, somebody check it out, because all it does is take one small little piece to get that diagnosis and be able to move forward with it.
So everyone should be checked.
Yes, I agree.
Oh yes.
I agree.
And you know, it's a man thing. We let it go. We really need to wear sunscreen and protection.
Yeah, thankfully the awareness for that is
Oh,
increasing now.
Very nice.
So
Right. But we feel like that it was God
oh yes, it was God.
watching over him because he forgot that appointment
did.
that morning at the VA.
yeah.
He thought it was later that evening.
it
So
doesn't God act
Oh,
in
he
miraculous
does,
ways?
because when I had to wait a month or so to get another appointment. Matter of fact, just the 8th of this month, I had to go. I went out there, and the guy I saw, I told him to tell him I was sorry I'd be there, and he told me, he said, no, thank God that you found it. It worked
Yeah.
as God in all
Yeah.
the way. It was great, and
Well,
we
good.
contribute that through God first, and through Amy
Yes.
Vaughan and the doctor in Pittsburgh. Great experience.
Yes.
If you can have a good experience, I have one.